Hi, I'm Christy Weber. I'm a fellowship-trained orthopedic oncologist here at Penn Medicine. I direct the sarcoma program at the Abramson Cancer Center, and I'm the chief of orthopedic oncology at Penn Orthopaedics.
Hi, I'm Kate Barry. I'm a physician assistant here at Penn Medicine in the Division of Orthopaedic Oncology and work with Dr. Christy Weber.
We're here today to answer some of your questions as referring providers. We want to reassure you that safety is at a premium here at Penn Medicine. Patients are understandably anxious about the COVID crisis in addition to their own personal medical situation if they're concerned about having a bone or soft tissue tumor. We want to reassure you how easy it is and how seamless it should be for your patients to get care here. Our office, 215-349-8200. We can get patients in every day of the week, whether in person at our various locations or by telemedicine. We want to be able to provide convenient, coordinated, and outstanding care from our world-class team. The most important and critical challenge that we've seen is that patients have occasionally chosen to delay care. So patients who might have a concern with bone pain or enlarging mass have decided to wait out the pandemic and concerns over their safety. And this is critical that we try and reassure patients that we're using all of the precautions. Penn Medicine is actually an incredibly safe place to come during the pandemic, given the strict precautions that we've taken. The more important thing is for a patient that may have a sarcoma or other type of bone and soft tissue cancer, waiting can actually have detrimental effects on the patient's life or their limb. We've seen examples of that, and we really want to reassure patients and providers that we can do this safely and be able to provide the excellent and expedient care that the patients deserve. We want to encourage you to have your patients give us a call to make an appointment. Specific situations would be increasing pain in a known or even an unknown bone lesion that starts to require more serious pain medications or narcotics, something that wakes the patient up at night. Other things would be an enlarging soft tissue mass in the extremities, the pelvis, the chest. It doesn't have to be painful. An enlarging mass is of concern and requires urgent evaluation.
That doesn't only apply to new patients. We would also encourage people who are already established with our practice or have already had a history of sarcoma to continue their surveillance scans and continue to follow up and monitor their history of sarcoma, and especially within the first 2 years of their surgeries and treatment, to continue to make sure that we are not seeing anything concerning. We do also offer telemedicine as well, just to make sure that we are surveilling them appropriately, as well as getting scans locally or at a local Penn Medicine site to try to keep up with all of this.
There are patients who are elderly or might have comorbidities, and if they are multiple years out from their treatment, it may be possible to get imaging locally with their primary care physician or other doctor team. We can upload those imaging studies either electronically or have a CD mailed, and we can perform a telemedicine visit. So we prefer to see the patients in person, but we have the option essentially to see patients every day, either in person or by telemedicine. Penn Medicine's been incredibly focused on safety of patients. We've taken precautions such as the regular use of personal protective equipment, the use of social distancing in our waiting rooms, limited family members in clinic rooms with the patients, and temperature checks.
The other thing that we're doing is regular COVID testing for patients who are scheduled for surgical procedures and certain bone biopsies. We will be getting COVID testing on patients at least 72 hours prior to surgical procedures and certain bone biopsies. So that ensures the safety of both the staff as well as patients before any type of invasive procedure. And we do understand that with cancer patients that it can be a very trying time, and we are talking about difficult things. So we are allowing and providing companion passes for patients' family members to accompany them to their visits as support and an extra set of ears during these trying times.
In addition, if a patient is having surgery and there are special circumstances where they need more than one family member in the surgical waiting room, we can accommodate that with an exception or a pass. There are some patients who have elderly family members that can't drive into Philadelphia on their own and they need additional support. We have an exceptional team here at Penn Medicine and Penn Orthopaedics. I have 22 years experience as an orthopedic oncologist. We're going to provide the same care whether it's during COVID or not during COVID. The entire orthopedic oncology team has an exceptional amount of experience, and the care should be seamless. Our philosophy in orthopedic oncology here at Penn is that we treat patients as if they're our own family members. We want to have quick appointments. We want to have quick results. We want to care compassionately for the patient and provide results in an honest but compassionate manner. In addition, our entire multidisciplinary team is outstanding. We have decades and decades of experience with all the different physicians that make up part of this team, in addition to the advanced practice providers, nurses, administrative personnel, and everybody has the same philosophy. We really want to think about putting ourselves in the place of these patients to be able to provide the best care.
COVID or not, we really do try to make this a very seamless and expedited experience for every single patient. I myself have several years experience with Dr. Weber and at Penn Medicine in orthopedic oncology, and I will be along with you every step of the way. I am always available by phone or my Penn Medicine and work with patients very closely and develop very significant relationships with these patients and really try my best to move along their treatment process with them. Something else that we're doing is our nurse is calling our patients several days beforehand, again, regardless of COVID or not, just to try to make sure that we can expedite their visits, including to make sure they have everything that they need, documentation, imaging studies. She's also going over with them any concerns that they would have potentially about the COVID time, talking about protective equipment, asking them about their medical history just to try to make it seamless. We also, at that time, are also discussing if the patients would like to have a family member along to make sure they do have that companion pass so there's no issues when they arrive here.
Another issue that we should bring up is the idea of imaging. There's rarely a patient I see that we don't need to have some type of imaging study. It's been traditional that we ask patients who have gotten their imaging done outside of the Penn system to bring a CD, but we now have the capacity to electronically upload images as long as the patient or their family member works with our office to do so, and it's pretty easy. So we're always going to need those type of additional studies to be able to fully evaluate the patient's concerns. I think the easiest way to get in to see us is to call us at 215-349-8200. We don't want patients to have to go through a call center. We don't want patients to have to wait on hold. And we're going to facilitate everything about the visit. We're going to remind patients about how to get their imaging studies either uploaded or brought with them. If they've had a biopsy, we're going to talk about how we can get those biopsy slides sent to our office for review. We can talk about the various details of the visit itself. But essentially, we should be able to get the patient in within 24 hours, any day of the week. Again, either an in-person visit or a televisit. We've got several locations. It's really easy. If you would like to talk to me on my cell phone, it's absolutely no problem. Just talk to your Penn Medicine liaison, and that number is readily available. We want to make this super simple for you.
I'm also available to discuss patients if there's any questions. The nurse practitioners and PAs out there, I'm happy to go over patients if there's any concern or if you have any questions about how to get the patient in to see us. Another thing that I did want to bring up is that we can expedite patients' appointments and try to get as many things done at that visit as possible if we're able to. Some of those things include same-day biopsies. Given the fact if we do have all the documentation and imaging ahead of time, we are able to review those things, and if we're able to set up same-day biopsies for patients to try to minimize the amount of times they're coming out to Penn Medicine, as well as decrease their risk of exposure to COVID. I know that's also a concern. If that's not readily available, we do sometimes have the capabilities of setting up same-day biopsies without having that imaging ahead of time. That's not always promised, but that is something that we have been known to do in the past. As Dr. Weber had mentioned, we are available via telehealth or in-person visits. Telehealth is a very quick way to get patients in, to start the conversation, to go over things that we can, knowing that at some point we may need to see them in person to have discussions about surgery and more finer details about treatment. But that's a way to just get the patient started and get things that we need to continue their care.
We absolutely triage, and that's the great thing about our sarcoma program and our office in particular. We'll triage. So if you're not sure, if the patient you think has a bone or soft tissue tumor of the head and neck, of the spine, of the abdomen, we'll be able to take that information and route you to the correct provider if it's not orthopedic oncology. We also can coordinate multiple visits on the same day. So if we understand the problem, it may be that the patient sees our team in addition to a radiation oncology team or a medical oncology team. We're all in the same clinic space. We talk to each other all the time. The team we have is world class. The clinical expertise is amazing. We share information on a weekly, if not daily basis about our patients that we manage together. We have a multidisciplinary conference every Wednesday morning. Now it's virtual. And present many, many cases. There's very complex, but we have 20 to 25 providers on the line that are providing their expertise in what the options are for the patient and what the best next steps are. In the operating room, if we have a patient who has a complex pelvic sarcoma, we might combine orthopedic oncology with urology, colorectal surgery, vascular surgery, plastic surgery. We have all those people right here talking on a regular basis.
We have various locations for in-person clinic visits, as well as the ability for telehealth visits, which would have access to patients all over the region.
Call us anytime. You can call me anytime. We're here for your patients. We're here for you.